Dear students, Dr. Ashok from Yamanagar here will be talking about the topic of acute gastritis. So it is mentioned in your syllabus for BAMS, Emergency Medicine Studies. And before going further, I will request you to go to my app, download it from Google Play Store, Dr. Ashok and subscribe to it and share it with your colleagues. You will get so many other lectures of your subject, of your syllabus as per the Indian आयुर्वेदिक आपकी जो इंस्टीट्यूशन उसके अकॉर्डिंग जो सिलेबस इमरजेंसी मेडिसिन का दिया गया है उसमें एक्यूट गैस्ट्राइटिस इज़ वेरी इंपॉर्टेंट टॉपिक. सो फर्स्ट ऑफ ऑल definition. What is defined or what is meant by the term acute gastritis? Acute means of sudden onset. So it is an inflammation of the gastric mucosa when the gastric mucosal barrier is disrupted. So the gastric mucosa means stomach की mucosa. The mucosa of the stomach, this is stomach. Now this is mucosal lining. So but as per the definition, there is disruption of this lining of the stomach because of inflammation by various factors. That term is known as gastritis. So then what are the various causes of gastritis? Why this occurs? There occurs disruption means like this, maybe ulceration at a later stage, or there may be inflammation, swelling of the lining of the stomach mucosa. Now what are the various etiological factors? Number one is drugs, very important. Various drugs which we prescribe or which the patient takes from the chemist or from the doctor for various reasons, they may lead to this type of condition. The most important being anti-inflammatory drugs. These are called non-steroidal anti-inflammatory drugs. So first important cause is NSAID. Now under this NSAID, every drug is included. For example, aspirin, even diclofenac, aceclofenac, ibuprofen, indomethacin. All these categories of drugs are involved or are taken in NSAIDs. Second group of drugs is steroids. Like prednisolone, we usually use dexamethasone and triamcinolone, Kenacort tablet. So all these type of steroids can lead to gastritis. Third drug is antibiotics. Under the group of antibiotics, the important drugs are tetracyclines, then erythromycin, doxycycline. So these are important antibiotics. And then antimitotic drugs. Antimitotic drugs means the drugs which are used to treat cancer. So these are first etiological group of drugs or causes. Second number is renal failure. Renal failure, that means kidney shutdown because of various reasons, important being diabetes, hypertension, then chronic glomerulonephritis, etc. Third is H. pylori infection. H. pylori infection. Now this is a bacteria which causes infection of the lining of the stomach and leads to common symptom gastritis. So H. pylori infection. Third is other bacterial infections like any type of infection, meningitis, enteric fever, dysentery, diarrhea, pneumonias, bacterial infections, even viral infections like mumps, measles, etc. And then fungal infections may also lead to gastritis. Then fifth cause is alcoholic abuse. The persons who are indulging in lot of alcohol consumption, that will also lead to inflammation of the lining of the stomach. That is known as alcoholic gastritis. Cause of alcohol, it is alcoholic gastritis. Alcoholic gastritis. Then another cause is iron therapy, and then stress gastritis. Very important. Stress gastritis means because of mental, physical stress, burns, CVA, and acute or chronic conditions of the body, the patient may get this disease, that is acute gastritis. So these are various etiological factors. Now coming to the pathogenesis. Now this gastric mucosal barrier which I have drawn is made up of three linings. Superficial epithelial cells will secrete bicarbonate. Then mechanical barrier is formed by tight junctions of the cells. And third is microvascular circulation of gastric mucosa. So these three things form mucosal barrier. Number one is superficial epithelial cells. They secrete bicarbonate करने की वजह से उसमें एसिडिक चीज़ को वो न्यूट्रलाइज कर देते हैं. सेकेंड इज मैकेनिकल बैरियर बिकॉज सेल्स आर प्लेस्ड बिल्कुल टाइट बाई टाइट, साइड से एक दूसरे के साथ, जैसे ये मुड़ी है इस तरह से ये सेल प्लेस्ड हो. And then microvascular circulation that helps in early regeneration of the gastric mucosa. When barrier is destroyed due to any etiological factor, mucosa becomes inflamed and gets ulcerated. So जो भी फैक्टर की वजह से इन्फ्लेमेशन हो गया, फिर यहाँ पे अल्सर बन जाएगा. This is called gastric ulcer. Now this inflammation or ulceration can be observed by endoscopy. It is a procedure of examining the stomach inside lining by a tube endoscope that is put inside the body of the patient. मुंह के रास्ते से हम लेके जाते हैं. Then pharynx, then esophagus and stomach. A camera is there from where we look at it, and उस कैमरे की करेक्शन टीवी के साथ लगा होता है, कंप्यूटर के साथ. वहाँ पे हम देखते रहते हैं कि वो पेशेंट का, और उसको हिलाते रहते हैं एंडोस्कोप को. इस वाली साइड पे ग्रेटर कर्वेचर, लेसर कर्वेचर, फंडस ऑफ द स्टमक, पाइलोरस ऑफ द स्टमक, गैस्ट्रोइसोफेजिक जंक्शन, everything is scanned by their endoscopic camera. उसके बाद हम उसकी पिक्चर्स फ़ोटो भी लेते हैं. अगर हमें कोई अल्सर दिखता है तो हम उसकी बायोप्सी भी ले लेते हैं. बायोप्सी लेके वी सेंड फॉर इट्स histopathological examination to rule out any malignancy or to rule out H. pylori infection or any other disease of that ulcer crater. So this is the procedure of choice to diagnose gastritis, that is upper GIT endoscopy. There you may find hyperemia means लाल लाल उसको दिखेगा, वास्कुलेशन और वास्कुलेचर बहुत ज़्यादा दिखेगा, नंबर 2 आपको क्या दिखेगा, म्यूकोजल इरोजन्स, जगह जगह निशान मिलेंगे जैसे कट्स लगे होते हैं। एंड थर्ड हेमरेज भी दिख सकता है उसमें आपको कि उसमें हेमरेजिक है। और एडवांस्ड कंडीशन ऑफ गैस्ट्राइटिस प्रेजेंट्स एज गैस्ट्रिक अल्सर, तो अल्सर भी हमें दिखे। So all these things are seen on endoscopic examination. There may be slow oozing of blood from the ulcer. So उसके बाद हम उसको वहाँ से सक्शन करके हम टेस्ट कर सकते हैं कि पेशेंट के इसमें से ब्लड जो है वो कहाँ से आ रहा है और किस तरह का ब्लड। उसके बाद वहाँ से वेयर वी गेट दिस इन्फ्लेमेशन वी कैन टेक द सैंपल ऑफ दैट म्यूकोजल secretion and get the rapid test done for H. pylori infection, that is known as RUT, rapid urease test. तो उसमें हमें अगर it is positive it means that the patient has H. pylori infection. Now what are the various clinical features? Number 1 is फीचर ऑफ डिस्पेप्सिया। डिस्पेप्सिया का मतलब पेशेंट कहेगा कि मेरे को यहाँ पे ना गैस बन गया, हर टाइम डिकारें आती थी, गैस्ट्रिक इरिटेशंस डिकार कहते हैं हम उसको भाषा में। और पेशेंट का कहता है कि मेरे पास यहाँ पे हार्ट बर्निंग, जलन सी फीलिंग होती रहती है। सो दैट इज़ फीचर ऑफ डिस्पेप्सिया। देन पेन इन द एपिगैस्ट्रियम, दिस इज अवर एपिगैस्ट्रियम। एज यू नो एब्डोमेन हैज 9 quadrants, upper 3, middle 3, lower 3. Upper 3 are on the right side, right hypochondrium, epigastrium, left hypochondrium. Middle component lumbar, umbilical, lumbar, iliac, suprapubic, iliac. So 9 quadrants. The patient will have pain in the epigastrium where the stomach is usually placed. There may be history of nausea and vomiting and pain after intake of meals or any food material. Then next, hematemesis, that is blood in the vomitus, is quite frequent in patients of gastric ulcer, even in inflammatory diseases of the stomach lining. And there may be iron deficiency anemia, because if there is ulcer that is slowly oozing blood from it, and it will lead to chronic anemia. So this type of presentation or clinical feature goes with acute gastritis. The diagnosis, as I've told you, is done by upper GIT endoscopy. Treatment, number 1 is stop the offending agent. अगर आपको हिस्ट्री में पेशेंट बता रहा है कि मेरे जॉइंट पेन्स के लिए मैं डाइक्लोफेनिक या हरे रंग की गोली खाती हूँ, हरे रंग का पत्ता आता है उसकी गोली खा रही हूँ सुबह शाम, या मैं कोई देसी दवाई खा रही हूँ दर्दों के लिए, क्योंकि देसी दवाई जो देते हैं हकीम वगैरह जो ये बैठे होते हैं उसमें स्टेरॉइड्स होते हैं, हैवी मेटल्स होते हैं, दैट में ऑल्सो लीड टू गैस्ट्राइटिस. सो वी आर टू स्टॉप द ऑफेंडिंग एजेंट. Any antibiotic if we are giving, that should also be stopped. Then we are to give for the relief of pain antispasmodics. Then number 3, we are to give antacids like digoxin, gelusil, MPS etc. Aluminium hydroxide and magnesium silicate के combination आता है. उसके बाद we are to give specific drugs like H2 blockers or PPI, that is proton pump inhibitors. 2 टाइप की ड्रग्स आती हैं, H2 blockers, and proton pump inhibitors. short written as PPI. So H2 blockers are ranitidine. Commonly used drug is ranitidine or famotidine. Ranitidine and famotidine. Now these two drugs are very commonly used and available and cheaper in cost. Second group of drugs, PPI, they are very commonly used nowadays. All of you must be knowing pantoprazole, omeprazole, rabeprazole, lansoprazole, etc. So these two group of drugs are used and they are to be used for 4 to 6 weeks. Then if the patient has been found, next point in management, if the patient is found to be positive for H2 pylori infection, then we are to give a course of antibiotics which is a polypill, that is a combination therapy. This includes amoxicillin, metronidazole and one other drug, that is fluoroquinolone. So all these three drugs are given morning evening in the form of kit, that is known as HP kit, HP pylori kit. So these drugs are given for 2 weeks and then we are to give proton pump inhibitor for another 4 weeks. Then if the patient is having severe anemia or he is having hematemesis, then blood transfusion may have to be given to tide over the period of shock or the period of emergency in that patient. So this is regarding acute gastritis, and acute gastritis is very common condition seen in OPD. Patient usually take the medicine from chemists. PPIs are very over the counter medicine, Pentop D, Pentop DSR, Pentotec, omeprazole, Osate, lansoprazole, etc. So this is the topic acute gastritis. So again, request you to go to Google Play Store, open my app Dr. Ashok Kumar Rana and subscribe to it and share to it. You can purchase the course as per your convenience. I have given discount for the purchases. You can go and look into Class Plus app. So that's all. Thank you.